For many years, health was explained through two main pillars: what we eat and how we move. Diet and exercise were seen as a foundation of wellness, and for a long time, that framework felt complete. Later, however, a third pillar emerged that reshaped this understanding entirely. That pillar is the environment. Environmental factors quietly influence health in ways that are often overlooked. They shape how the body responds, heals, and functions. This realization did not come from textbooks alone, but from lived experience in medical practice. Over time, it became clear that health is not just lifestyle-driven, but deeply connected to the spaces we inhabit. After graduating medical school and completing a fellowship, there is often a sense of confidence that borders on certainty. Entering private practice can make a physician feel as though the key answers have already been learned. At that stage, it felt obvious that diet and exercise explained most chronic health issues. Lifestyle medicine appeared to be the ultimate solution. That belief, however, was challenged in a profound way. Experience has a way of exposing gaps in even the most confident assumptions, and medicine is no exception. What seemed like clarity slowly unraveled as real patients presented problems that did not fit the expected model. One particular patient changed everything. She was a highly successful CEO, disciplined, motivated, and doing everything right. Her diet was controlled. Her exercise routine was consistent, and she followed every recommended lifestyle guideline. Yet despite all of this, she felt unwell. She was exhausted, mentally foggy, and gaining weight. The immediate reaction was to push harder on diet and exercise, assuming something was being missed. Years later, that certainty proved wrong. The true cause of her suffering was environmental exposure, something barely discussed at the time. That realization led to a difficult but necessary apology years later. Her health struggles were not a personal failure or lack of discipline. They were driven by exposures that significantly disrupted her physiology. These kinds of environmental burdens affect far more people than previously recognized. Early in practice, these factors were rarely considered, largely because awareness and testing were limited. Environmental medicine simply was not part of mainstream thinking. Today, however, conversations around complex illness, toxins, and chronic exposure are becoming more common, forcing a broader understanding of health and disease. A key question arises: are these illnesses increasing, or are we simply better at identifying them? The answer appears to be both. Modern life brings unprecedented exposure to chemicals, microplastics, heavy metals, and biological toxins. At the same time, diagnostic awareness has improved, though it still lags behind reality. Mold, in particular, has become a frequent topic of discussion. People notice musty smells in buildings and assume it is harmless. Yet for certain individuals, mold exposure can trigger profound reactions that impact the brain, immune system, and overall vitality. Some people can enter a mold-contaminated environment and immediately experience rashes, headaches, fatigue, and brain fog. These reactions are driven by mycotoxins, toxic byproducts produced by mold. Despite this, validated and universally accepted tests for mold-related illness are lacking. Unlike conditions such as diabetes, there is no simple, definitive blood test. This creates uncertainty for patients and clinicians alike. While tests like toxin panels exist, they are not considered definitive, leaving many sufferers without clear answers or validation for their symptoms. As awareness grows, more individuals are recognizing patterns in their own lives. Many believe they were simply aging, becoming moodier, or losing energy naturally. Fatigue, low motivation, joint pain, and brain fog were dismissed as normal entropy. Yet for many, these symptoms are driven by environmental stressors rather than time itself. This misattribution leads people to accept suffering unnecessarily. The environment plays a silent but powerful role, influencing how people think, feel, and function on a daily basis, often without obvious warning signs. Diagnostic uncertainty adds another layer of frustration. Patients often undergo extensive blood testing, only to be told everything looks perfect. Standard biomarkers such as thyroid hormones, testosterone, and basic inflammation markers may fall within normal ranges. However, these tests represent only a small slice of human biology. They do not capture the cumulative burden of toxins, infections, or chronic exposures. As a result, People are left feeling unheard and unexplained, despite experiencing very real limitations in energy, recovery, and mental clarity. Joint pain, muscle aches, and poor recovery are increasingly common complaints. These symptoms are often labeled as arthritis, overtraining, or stress, yet environmental factors may play a significant role. Mold, parasites, and chronic infections like Lyme disease can all contribute to systemic inflammation. These influences subtly degrade performance and resilience. Many individuals are functioning far below their potential without understanding why. Environmental medicine challenges the idea that unexplained symptoms are imaginary or purely psychological. An unexpected turning point came through working with elite populations. Treating celebrities and professional athletes was rewarding, but not deeply fulfilling. That changed with the arrival of a former special operations soldier. His lab work was unusual, and despite optimized hormones, excellent sleep, and consistent training, he felt terrible. He had visited world-renowned clinics with no answers. Subtle inflammation and liver abnormalities persisted. Eventually, a rare parasitic infection contracted abroad was identified, explaining his declining health and anemia. Parasites, though uncomfortable to discuss, can be devastating when left untreated. Infections such as schistosomiasis and amoebiasis can damage the liver and other organs over time. Globally, parasitic worms are among the leading causes of iron deficiency anemia. These infections often cause slow, chronic blood loss, leading to fatigue and weakness. Because symptoms are vague, many people live with parasites for years without knowing. Global food sourcing and travel increase exposure, making these infections more common than assumed. Transmission is not limited to food alone. Parasites can spread through shared living spaces, bathrooms, and even bedding. One partner may have symptoms while the other remains asymptomatic, unknowingly reinfecting them. This cyclical pattern makes treatment challenging unless all household members are evaluated. Pets also serve as vectors. Dogs, for example, can carry parasites like Giardia. Close contact, including licking faces or sharing beds, increases risk. Addressing environmental and household sources is essential for effective treatment. Testing for parasites presents its own challenges. Standard PCR stool tests are considered highly sensitive, yet real-world experience often contradicts this. Many symptomatic patients repeatedly test negative. In some cases, old-school microscopy performed by specialized parasitologists reveals infections missed by modern methods. Though uncomfortable, direct examination can uncover hidden parasites. This gap between theory and practice highlights the limitations of standardized testing and the importance of clinical judgment. Mold presents an even greater diagnostic challenge. Unlike parasites, there is no universally accepted diagnostic framework. Traditional environmental medicine often rejects mold detox protocols and urinary testing, citing insufficient evidence. Yet many clinicians and patients report consistent patterns of illness linked to mold exposure. This disconnect creates controversy. The art of medicine becomes crucial, balancing scientific skepticism with lived clinical reality. As with many emerging fields, evidence is evolving, but patient experiences cannot be ignored. Personal experience reinforces this reality. Severe illness following mold exposure can be sudden and debilitating. Brain fog, vision changes, exhaustion, and cognitive impairment may appear rapidly after moving into a contaminated space. Standard labs often appear normal, adding confusion. Specialized environmental testing can reveal elevated toxins and mold byproducts. Home inspections frequently uncover hidden mold growth. These experiences underscore how environmental factors can profoundly disrupt health, even in otherwise healthy individuals. Mold exposure affects the body primarily through inhalation, though contaminated food also plays a role. Sensitive individuals may experience neurological symptoms, headaches, rashes, flushing, and respiratory issues. Cognitive function and mood can be impaired. While the scientific literature remains cautious, clinicians consistently observe these patterns. Environmental sensitivity varies, likely influenced by genetics and immune response. What may be harmless to one person can be devastating to another, making mold illness deeply individualized. Attempts at remediation do not always resolve the problem. Even after extensive cleaning, filtration, and dehumidification, sensitive individuals may react within minutes of re-entering a contaminated space. Flushing, inflammation, and neurological symptoms can return immediately. These reactions illustrate how deeply environmental exposures can imprint on the body. Ultimately, this highlights a critical lesson. Health is not only about what we eat or how we exercise, but also about where and how we live.